Happy Juneteenth, everyone. And if you don't know what Juneteenth is all about, freaking Google it. In all honesty, I'd never heard of it until about 4 or 5 years ago. And in fact, it was just 4 years ago, thanks to the HBO series Watchmen, that I learned about the Tulsa, Oklahoma massacre in the Greenwood community, aka Black Wall Street. If that's not an indictment of the American education system, I don't know what is. In celebrating Juneteenth and the end of slavery in America, I'm coming to you in my capacity as a registered nurse. It is with great anguish that I report that there is a terrible disparity between white and black Americans in terms of healthcare. This is a plea to my fellow nurses, doctors, respiratory therapists, and other healthcare professionals to work to close these gaps and bring an end to racial discrimination in the American healthcare system. Did you know that black mothers consistently have the highest rates of preterm births and that their children have the lowest birth weights of any group of American women? African American women have a threefold higher rate of very low birth weight babies compared to white women. African American women are 3 times more likely to die of pregnancy-related causes than white women. The African American infant mortality rate is double the rate for white infants. To add insult to injury, it has been found that the negative health outcomes occur not only at the time of preterm birth, but also later in life, because preterm birth increases the eventual risk of coronary artery disease, high blood pressure, diabetes, and other chronic diseases. Not so fun fact, in America, the incidence of breast cancer is higher in white women, but the incidence of death is higher in black women. And this seems to hold true of most cancers. Black and brown people are systematically undertreated for pain. Studies show that many white people falsely believe black people experience less pain and are therefore significantly less likely to be prescribed pain medicine and are given lower doses when they do receive a prescription. I don't know about doctors, but to my fellow nurses, you and I were taught in nursing school that pain is what the patient says it is. It's not up to you or me to interpret or rationalize. How would you feel if you were in the hospital or doctor's office suffering severe pain and you are not believed or ignored? African Americans have endured racism in America for over 400 years. Studies conducted over time have been consistent in proving that racism impacts the ability of African Americans to be healthy, both mentally and physically. This burden causes African Americans to die prematurely and experience chronic illnesses and mental health challenges at much higher rates than white Americans. Real and anticipated racial discrimination is a source of chronic stress and has a cumulative effect. The cumulative effects that chronic stress has on mental health and physical health literally causes disproportionate rates of high blood pressure, obesity, heart disease, heart failure, stroke, diabetes, and premature death due to these chronic conditions and other comorbidities. Race-based discrimination, whether real or anticipated due to previous experience, are associated with higher resting systolic blood pressure and more frequent diagnosis of hypertension that leads to all those other comorbidities. I've only scratched the surface here. I haven't even talked about the lack of access to high-quality healthcare facilities or food deserts or police violence and killings of black people, or the fact that 56% of African Americans live in the South, and it is predominantly southern states led by Republican legislatures and governors who have refused Medicaid expansion under the Affordable Care Act, which would ensure a much greater number of black Americans to have health care coverage. So, to my fellow nurses, doctors, and other healthcare workers, please understand that there are absolutely no biological differences between white people and black and brown people. We are all Homo sapiens. We are all human. We got into healthcare to reduce pain and suffering and to promote healing of our fellow humans. This Juneteenth, let us recommit ourselves to treating all our patients with equity and equality, with respect and dignity. And let's do everything in our power to end racial disparities in healthcare.